Hello, I'm Dr. UshaRajagopal. I'm a board-certified plastic surgeon practicing here in the Bay Area for over 15 years. Welcome to my practice, the San Francisco Plastic Surgery and Laser Center. I have been in practice for over 15 years and graduated from UCSF here in San Francisco. I treat primarily cosmetic, plastic surgery and skincare patients. We certainly, being in the Bay Area, we see a diverse patient population, certainly a lot of Indian patients, but Asian patients and Caucasian patients. I am very well aware of how Indian skin heals, on top of what treatments work the best for this group. And me being Indian myself, I've had a few treatments done, and hopefully my whole goal is for you to look better, but very natural. You should look like you have had nothing done and you were just born beautiful and that you're aging very gracefully. A very popular procedure is a mommy makeover, where we actually address all the concerns of young mothers that has happened after childbirth. Obviously, after childbirth, the breasts do get affected. They're not as perky and uplifted as they were before having children. You can have some droopiness and sagginess of the breast and loss of volume. The abdomen also takes a large toll, where you not only get excess skin, you can also have some stretch marks and some muscle separation. And some of the excess skin and muscle separation cannot be treated with diet and exercise, and that's where an abdominoplasty or tummy tuck comes into play. The last factor is fat deposits in certain areas that are very stubborn and, again, very hard to lose with diet and exercise, especially along the hip and the lower back area. So when we combine these three procedures, the breast enhancement, the abdominoplasty or liposuction, then that's called the mommy makeover. Another procedure that I offer here in the office is for men. It is a problem that certain men can have, and it's called gynecomastia. It's when a man's chest and breast area is actually more developed than it really should be, and gives the appearance of having a man having the appearance of breast tissue. There are some slang terms for it. It's called man boobs or moobs and things like that. And so the procedure that's done is surgery, and that's the most effective for this problem. It works very well. It's a very short surgery with pretty fast recovery and extremely successful results. I do offer a lot of rhinoplasty surgery for the Indian patients. It's a very common problem that Indian patients come to me for. Other words, it's known as a nose job. I have been doing rhinoplasty surgery since 1995 and have hundreds and hundreds of very happy patients with this surgery. My goal is really to achieve a very natural look, so it blends in with the rest of the face, and for it to suit the other Indian features that you have, the beautiful eyes and the nice, usually very nice smile. It should not look like we picked out a nose from another race, so I'll give you a ski slope nose that looks very noticeable. Blepharoplasty or eyelid surgery is usually one of the first surgeries that we do for a patient that's aging. When someone develops excess skin in the upper lids, it starts making their eyes appear smaller and more tired. The same thing goes for fatty deposits in the lower lid. It gives you an appearance of tiredness. It gives you the appearance of having dark circles under your eyes. So the surgery is called a blepharoplasty or an eyelid tuck surgery. It is done under light anesthesia, and recovery is usually about a week or so and not very painful at all. Again, the goal with this surgery is really to give you a natural look and not make you look like you've had any surgery done. So for the aging patient, a facelift is a very good option when non-surgical options will not succeed. A facelift really consists of two kinds of facelifts. You can have a mini facelift or a full lower facelift. A mini facelift is for the younger patient who has just started showing signs of aging, where you get deepening of the smile line fold, or this is called the marionette line, or some early jowl area. And so you can get away with what's called a mini facelift. It's a little less invasive. A lower facelift is when someone is a little older, and in addition to these changes that I've talked about, also start having some looseness in the neck and really starting to have more loose skin. Then you actually have to address the neck also, where you have to tighten the muscle and tighten the skin. With both these surgeries, either the mini facelift or the lower facelift consisting of the neck lift, really the goal is to give you a more rested look, make you look more youthful and more energetic. One of the things we do with new patients is have them look at an album of a sample of my patients who've had that particular procedure done. As Indian patients, we are blessed with beautiful skin, but there are some issues that are very specific for our kind of skin. One of the big issues is pigmentation changes. Even though we have that beautiful cafe au lait skin, we do have areas of skin that are a little darker than the perfect skin, and some areas that may be a little lighter. A lot of these are really related to sun damage and just sun exposure. Obviously, some of it is also genetics. Generally, with Indian skin and darker skin tones, it is very important to treat the skin very gently. So with our treatments, we really treat patient's skin very gently, start out with basic things first, and then add on products and treatments as the skin tolerates it. If someone is a candidate for laser treatment, they would need to have the skin pre-treated for at least 8 months. The second thing to remember with skin treatments is that it is not a single treatment that works. It's usually ongoing treatments. The reason is that the skin is not a static structure. It is changing constantly. We actually shed our skin every 4 weeks or so. So even if you have nice skin, it'll last for about 4 weeks. And so you need to have constant upkeep on the skin to keep it looking its best.